All right, welcome back to another episode of Glow for Hope, Spark Conversation on Mental Health. We are joined once again by the fabulous Dr. Debra Muth. Debra's a certified naturopathic doctor and founder of Serenity Healthcare Center in Wisconsin. Known as a medical private detective, Dr. Muth has helped thousands of patients navigate complex health challenges, including chronic pain, autoimmune conditions, and the often overlooked connection between physical health and mental well-being. She's also an author and speaker, and her upcoming book, Seen at Last, dives even deeper into the mission of helping people feel truly understood in their health journeys. Welcome, Deb. Dr. Deb.
Thank
I'm so
you for
used to just
having me
calling you
back.
Deb.
That's okay. It's exciting to be here.
Yeah, we had such a great time talking with you about the challenges of mental health and chronic pain that we also wanted to talk to you, or you wanted to make sure that you shared with us along the lines of PTSD and what takes place within the mental health community. And, um, PTSD, everybody always thinks about it being just, like just linked to veterans. But, it is in so many other groups. So what are some overlooked causes of PTSD?
Oh, I'm so glad we're talking about this topic because I see it every day in my practice. You're right. PTSD is something we think of that happens to veterans or our first line responders, people who've been exposed to some pretty crazy traumatic events or um, traumatic brain injury, things like that. But I think it happens to us more often than what we realize. It happens from trauma. And when we have trauma over and over and over again, our bodies can perceive that trauma differently and we can get PTSD. And I often joke with my clients that many of them have PTSD of the medical community. We've inflicted that on them. And in part, it's because we've dismissed them. So if we think about it, every time we go to a practitioner and we share with them our most intimate problems and concerns, we're being extremely vulnerable and we're sharing with them something that most of the time we're not willing to share with the general public or even some of our family or friends because we don't want them to know exactly how terrible we feel. And then we get dismissed or we get told that it's not real. You're making this up. There's no way you can have all these symptoms at one time. It's all in your head. You get labeled with depression. You get labeled with bipolar or OCD or anxiety and all these things. When in reality, you had something else that was physically going on, but they didn't know it and they didn't know how to handle all these complaints that you had. And after you've gone to 5, 10, 15 practitioners or even two or three, and you get told the exact same thing, you start to distrust that community. And so when you do see the next doctor, you don't open up as much. You don't share as much. You hold back until you've developed a relationship with them that you trust, but sometimes you never develop that trust then. And I think this is where we see a lot of PTSD. We know so many people who have had PTSD from family trauma, being raised in families of alcohol and drug abuse. It's rampant in our world. Single family homes that have parents that are gone. Uh, they're working all the time. They're left alone. And we don't think about that as trauma, but as young kids, it can be traumatic for us.
Mhm.
And a lot of those things can start to spark that post-traumatic stress syndrome, right? That PTSD. And whenever we have this perceived stress and it's over and over and over again, that's what it becomes. And my idea of stress and your idea of stress are going to be two very different things, and how it affects us are going to be two very different things. And we can look at one kid that was raised as a latchkey kid and does great on his own and cooks and cleans and has no problem and is really independent. And you have another kid that was raised the same way and they perceive it as something very traumatic and abandonment, and they can't get beyond that. And so I think we don't look at this as PTSD the same way, and we don't recognize that that's what's happening in these folks.
It's an interesting comparison. And there's, I mean, there are different forms of PTSD too, right?
Mm-hmm.
Are
Correct. Mm-hmm.
like how many different ones, or what are there
Oh,
some that
gosh.
are just most prominent?
There are some that are much more prominent. For instance, if we take veterans, for instance, right? They get PTSD because they've lived in a world where things were very stressful and traumatic and their life was on the line. But I could argue that there's a lot of kids that are raised in that same type of environment. They live in neighborhoods that are not safe. They're worried of bullets coming through their house. They can't walk outside on the sidewalk in the daytime, let alone if it's after dark. And those same kinds of things can produce the same type of symptoms of PTSD. And with PTSD, when we look at traumatic brain injury and PTSD, it's amazing how many people have this traumatic brain injury that results in PTSD, whether it's repeated trauma from blast firing, whether it's they, hit their head, they were knocked out. Well, that happens to all of us, right? As children, when we learn how to walk, how many times do we fall and hit our head before we learn how to walk and stay up on our own 2 feet? And we don't ever think of that as traumatic brain injury. We don't ever think of the fall on the bike when we were learning to ride a two-wheeler as a traumatic brain injury. And the sad thing is when we have those traumatic brain injuries, the symptoms can take 17 to 20 years before we even start to recognize the symptoms from the traumatic brain injury that we had. And those traumatic brain injuries can then lead to those PTSD type symptoms. So the nightmares, the fears, the anxiety, the depression, the OCD behavior that we have. And we never look back to say, well, wait a minute, when Susie fell down the stairs when she was 2 years old because she just fell down the stairs and she hit her head at the end when she got there. Why would we think when we're 25 that that has anything to do with the OCD or the bipolar symptoms that we're presenting with today? We never look back at that. And I think there's a lot of mental health situations that are a result of those mild traumatic brain injuries that were never addressed and never dealt with. And that's why we're seeing some of these symptoms occur at this point and they're not getting appropriate help for them.
And a lot of that came about too in the NFL industry and
Yes.
boxers
Mm-hmm.
and stuff that they
Mm-hmm.
just,
Mm-hmm.
look at Muhammad Ali and all that happened with
Yeah.
him. You
Yes.
don't
Yeah.
think that those repeated blows over
Mm-hmm.
so much time.
Yeah.
So not specific to brain injury, but how does PTSD change the brain and body, and why does that matter for overall health?
Absolutely. So PTSD is more of a symptom of an inflammatory response in the brain, right? And so when the brain is inflamed, and there are very specific things that we can see on MRI to show that there's been a traumatic brain injury or somebody has PTSD or anxiety or depression. Those things you see more on what's called a SPECT scan versus an MRI. But we can actually see the different parts of the brain being inflamed that can tell us what we're dealing with a person. And so when you see this on brain imaging, which very few people do in the mental health world, nobody does it. And if you're familiar, you follow Dr. Amen was one of the first people to do this, to start imaging brains and start looking at what does a brain of somebody with anxiety look like? What does the brain of an ADHD person look like, or bipolar or OCD or PTSD? And we can now see these things on SPECT scan. And depending on what part of the brain is actually inflamed, will give us different symptoms. So if one part of the brain is inflamed, like the prefrontal lobe for that matter, if that's inflamed and it's always on, we call it hot. If it's always hot, you're going to have more cognitive issues versus another part of the brain that may be more related to depression or anxiety. And so once we can identify these types of things happening within the brain, we can actually create a more individualized plan for patients. We would know what drugs are better to be treated, what drugs should be avoided, what supplements should be done, what diet somebody should follow. We can really individualize that treatment plan once we know what's happening there in the brain.
So why doesn't that kind of examination happen more often?
It
If
should
it's
happen.
known, if it's known that
It's,
it helps, then why wouldn't?
yes. Why wouldn't our traditional medical system do this, right?
Right.
It's known, and Dr. Amen's been doing this for, gosh, I want to say well over 15 years, if not maybe a little longer than that. He has thousands and thousands of scans that he's done, probably tens of thousands of scans that he's done, and conducted research on all of this. And we still ask ourselves, in the world of prevention, why don't we do this? Because it would be much more cost effective to do a $1,500 spec scan and treat the patient once and have them have an amazing life and not have them end up on disability because of these things and not having a life that can function versus giving them all the drugs, making them worse, giving them more side effects, and getting them to a point where they can't function in the world that we've created. And now they're on disability for the rest of their lives. Why this happens, I don't know. It's our healthcare system. Our healthcare system is broken. It's considered alternative medicine, so insurance doesn't typically cover it unless there's been a major brain injury. Sometimes I think it's covered though too if people are diagnosed with like Alzheimer's or dementia, you can get some coverage for some of these things. It really depends on the insurance company and whether or not they're willing to put the funds forward. It's my opinion that if they put a little bit of money on the front end, we'd save a whole lot of money on the back end for getting people the help that they need and less drug costs, less medical costs, less disability costs. These people would have a better life. They'd live an amazing life if they just had the care that they needed. And it's really sad.
It is, and that's probably a rabbit hole we don't want to go down on this show. But I get you. I get you.
Yeah. Yeah. Hmm.
So, what what kinds of everyday triggers might bring PTSD to the surface, especially for people that don't realize they even have it?
That's a great question. So a lot of the triggers are going to be whatever caused the PTSD in the first place. So what the trauma was, right? So if the trauma for you was that you were left alone at a young age and you felt abandonment, when you're left in a house all by yourself, that could trigger some major anxiety for you or some OCD for you. Um, if the trigger is you were raised in a house where there was a lot of fighting going on, you might get triggered by hearing somebody raise their voice to another person, or just have a certain tone or say a certain thing that could trigger a PTSD episode for you. For people who have PTSD of the medical community, simply walking into a medical office could trigger their PTSD symptoms where they can get anxiety and depression and lose their thoughts and not be able to speak clearly, or feel enough anxiety where they feel like they just want to turn around and run. They want to get out of that office. And for those people, doing a telehealth visit may actually be better for them because if walking into the building triggers that for them, not having to go in there may be helpful. Or seeing somebody in a white coat could be very traumatic for them.
White coat
Um,
syndrome.
White coat syndrome, exactly. If you were in a car accident, um, getting into the same car that you drove when you were in the accident could be a trigger for PTSD for you. Having somebody come up alongside of you too close could trigger a PTSD episode. I was in a car accident in 2014 and I didn't really think it bothered me until I started driving by myself. I was fine. But when I was the passenger, because that's where I was in the car accident, it would it would drive me nuts. Like my husband would get 3 car lengths away and I'd be hitting the brakes in the car, on the passenger side, and I'd be gripping the walls of the car. And he'd be looking at me going, "What is wrong with you?" And I'm like, "I don't know." And it took me a really long time to realize that this was a PTSD reaction that I was having. And even still today, if I'm the passenger and a big semi truck comes up alongside of me, I'm jerking, I'm grabbing something and I'm feeling this surge of energy. And it's not anything conscious that I do. It's just something has happened.
Mm-hmm.
And it still happens to this day. It shouldn't after all these years, but it still does.
It's weird how those things come up, and
Hmm.
I was always pretty fearless in driving and stuff, and
Hmm.
until I took a trip to Kentucky with my son, and we were the only ones in the car, and I have trouble seeing at night when the bright lights and
Hmm.
stuff are coming toward me,
Yeah.
and there
Hmm.
was construction going on, and we were like right
Hmm.
on the edge of the road where they had it,
Hmm.
the lane, and it was like the drop off on the side, and that freaked
Oh,
me out, and I was just
yeah.
white knuckling, like you said. And then
Uh-huh.
ever since then, when I get too close to the edge and it's like, I don't care how far ahead I'm looking and I try to avoid
Hmm.
that, it still just gives me weird tingles and stuff.
Uh-huh.
It's very, but you don't realize that things like that
No.
are gonna trigger you.
Hmm. Yeah, I'm still waiting for a cop to pull me over at night when I drive because if I'm coming towards somebody, I always kind of swerve over because I always feel like I'm too close. So I'm swerving over and I'm like, there's some days on those 2 lane highways, I'm doing a lot of that swerving over. So I'm just far enough away, And I'm like, one of these days, a cop's going to pull me over and think I'm drunk, but it's not that. It's just, and I do it without even thinking about it until after it happened. And I'm like, oh my gosh, why did that happen again? It's just that subconscious mind that's making us do those things. And we're not always in tune that we're doing it until way after the fact, or it's happened enough times that you're like, wait a minute, why do I do that all the time?
Yeah.
And then you think back and you can start to figure out why it's happening to you.
Yep. So, in your experience, what role does community support play in PTSD recovery?
I love this question. I think it's huge. I think that if we use community as our support mechanism to help people with PTSD, they can get over it quicker. Like it's that concept that if we tell people what's going on, the community will come to our rescue and see things before we see them, right? Um, I think community is huge in everything. I don't think we can live as a solo society. I think we're communal beings and we need to have community surrounding us
Mm-hmm.
to survive, and to help each other out. I think it takes a community to raise a family, to raise a child, to take care of our elderly. I think that without it, I think we're doing a huge disservice to our veterans, to us as people. I think in a community where we're seeing trauma, if we don't intervene and help the person that we know is being traumatized, whether it's the victim or whether it's the person observing the trauma that's happening, I think we're setting those people up for having problems down the road. You know,
Yeah, for sure. The old adage of it takes a village, and it really does.
it really does. Yeah.
It really does.
Yeah. I mean, I think about the communities where there's a lot of trauma all the time and there's a lot of abuse and you have maybe a mom or a grandmother that's in the community that takes on the young child in a family that is abusive and they take that child in and they show them love and support and they help them understand that life doesn't have to be that way. I think if more community people could do those kinds of things, that child would have an opportunity to realize that life isn't always like that. And I get that it's hard in community to do that, right? Because we're all afraid to get involved. We don't want
Mm-hmm.
to stick our nose where it doesn't belong for a lot of reasons. But I think having that community, whether it's a physical community or an online community where people can have that support, I think it's invaluable.
Yeah, I agree. And to think that one person really can make a difference for someone, and
Yes.
and once they see, once other people see that that one person can do something and make a difference and help a person,
Hmm.
then it starts to work and trend like the
Hmm.
commercial. I told two friends
Hmm.
and they told two friends, and
That's
if
right.
we could get back to that, I think as a
Hmm.
society that it would be so much better than the path that we're going on now. And
Hmm.
so I would encourage people not to lose sight of that you can make a difference.
You can, even if it's seeing somebody in social media who's pouring their heart out about something that's happening to them, you know, private messaging them and giving them some words of encouragement. You don't know how that can change a person's life. That one word from the right person can change the trajectory of everything that happens for them. And instead, sometimes I see a lot of people being negative on social media and that's not a helpful situation. I understand why people do it sometimes. It's not helpful though. But if you have that one person that breathes some life into you and some love into you, boy, it can change the world. It really can.
Absolutely. And it can come from the strangest person that you even think.
Yes.
It's like
Yes,
I was
exactly.
I was talking to somebody the other day about how uh, someone I hadn't seen her in a while, and it was somebody that had
Mm-hmm.
passed. It was a good friend, and I had showed up at the funeral, and she just lost it when she saw me
Right.
and
Mm-hmm.
someone else and my husband, and it was like, I totally get that, because it's like when
Mm-hmm.
you're upset about stuff, and it just you're trying to be strong for the people that you're
Yeah.
there with, and that's a lot to put on you. And then when you
Mm-hmm.
kind of come face to face with someone that you know that you can be vulnerable with, they're not going to
Mm-hmm.
judge you. They don't care. It's just a release.
It is. It is.
Um,
I had the best advice come from a woman that I worked with many years ago. I was really young. I was probably like 23 years old. And my dad was an alcoholic. My mom was very codependent. He was a functional alcoholic, but nonetheless, he was an alcoholic. And we had our ups and downs in the household as a result of that. And I remember complaining to her about my upbringing and my dad and how he wasn't there for me and this and that. And she looked at me and she said, you know what? She's like, parenthood doesn't come with a book. It
mhm.
doesn't tell us what to do. We do the best with what we have and what we know. He's doing the best with what he had because he's doing what he knew from his family and his childhood and what his parents gave him. And it may not be perfect. It may not be what you want it to be, but it's all he knows. And it doesn't mean he doesn't love you. It's all he knows. But you have an opportunity to change the way you're bringing up your children when you have them because you know differently at this point. And I remember sitting there going, wow, like it was the most impactful conversation I had ever had about this with somebody. And it completely changed the way I looked at my dad. And I didn't look at him as the alcoholic anymore. I looked at him, unfortunately, more as a victim. Like I looked back and saw how his parents treated him. And I was like, yeah, now it explains a lot as to why he was who he was. And he couldn't help it. He just did the best he could. Um, and it totally changed the relationship I had with my dad. And at that moment, I forgave my dad for not being the dad I wanted him to be because he couldn't. He just couldn't.
Acceptance is a lot.
Yeah.
It's
Yeah.
that's good.
Hmm.
That's good.
Hmm.
So, how can integrative and holistic care kind of complement the traditional treatments like therapy or medication?
Love that. Holistic care is so much nicer because our first line is not drugs, right? It's not looking for the same medications that the traditional doctors know how to give. We have a whole arsenal of things that we can use, tests that we can do, supplements that we can use, herbs that we can use. The difference between a SPECT scan and MRI, right? Or neurotransmitter testing and vitamin B testing. Most of your traditional doctors won't even do a vitamin B level. They just started doing vitamin D levels, like accepting them and getting paid by insurance, like not more than like 16 years ago. 15 years ago, they were still not being covered by traditional insurance, where all the functional medicine doctors were already ordering those things because we saw how big of a impact it was on mental health, just getting somebody's vitamin D level optimized and their energy levels. And so when you utilize alternative medicine, you can get the best of both worlds. You can get the conventional things that you need, and some of it can get covered by insurance. A lot of it doesn't, but you get a lot of the non-conventional things because unfortunately in these big organizations, the doctor's hands are tied. There's only so much they can do. And if it's not FDA approved, they are not allowed to do it. And therefore it's not an option for you. Well, in an integrative space or an alternative space, we're not regulated the same way by the FDA. We don't have the same regulations by big organizations that we work for. So we can provide different things. Peptides are a great thing for mental health. Peptides are small branch chain amino acids. So we get all of our amino acids from proteins. But if we don't digest proteins or we don't have enough protein in our diet, we're not going to make these amino acids. And therefore we can't make peptides. And peptides are just little messenger signals that go to different parts of the body. And we ask the body to do different things. So for instance, there's a peptide that can heal tissue and regenerate tissue and reduce inflammation. There's peptides we can use for anxiety and depression and cognitive function. So if somebody has dementia or Alzheimer's disease, there's peptides we can give that can help support that. There's peptides we can give for the neurological system. There's so many thousands of peptides in the environment that we know of today that is just going to grow as we learn more. But some of these are the things that alternative medicine practitioners can offer that the traditional doctors can't do.
Hmm. And then sadly, that's the whole insurance thing again. But
It is.
it's it's uh
Hmm.
it's a challenge. But I think that you can, with, if you become your own advocate as the patient, that you can find somewhat of a middle ground
Hmm.
on balancing both of them, or one
Absolutely.
respecting the other. And sadly, it's usually the Western or traditional medicine that's not respecting the other side so much. But like you
Right.
said, their their hands are tied by so
Hmm.
many
Hmm.
regulations. But
Yeah.
I know it's
Yeah.
been I've never really gotten into the whole peptide side of things. I think
Hmm.
it's interesting, but you have to really understand those. I want to make a point of that you have to
Yes.
understand it. You can't just go out and research this peptide that I heard about and go try it, right?
Correct. Yes. Don't go buy it from a website that says not for human consumption, research purposes only, because there are horror stories of that. Peptides that come in from other countries that they think if this peptide is good, it's better if we add testosterone or it's better if we add this. And you don't know those things are added to it. And before you know it, everything's off in your body. And you're thinking it's the peptide, but it really wasn't the peptide itself. It was what was added to it. So if you're going to do a peptide, you need to work with somebody that really understands peptides and they can get it for you at a quality place that is reputable, that you know is going to be what it says it is. Yeah, please don't just go out and chat GPT this and start using peptides and buying them for wherever, because it could be catastrophic for you for sure.
Right, right. Yeah, being educated is huge. That's and that's how I am with you. I mean, I love what you do. I love the knowledge that you do, and you stay on top of things. And even if you went down a path of not being
Mm-hmm.
for this certain thing at one point in time,
Hmm.
things change. You do more research on
Hmm.
it, and
Yeah.
so then you can get behind something that you might not have
Hmm.
started out that way. And
Yeah.
so I think that's great. And now, is there, just because we're talking about different kinds of
Yeah.
medicine here, the osteopathic
Hmm.
doctors, is that supposed to be kind of like a, I don't want to say in between, or
Hmm.
like
It
between the
is.
two of
Yeah.
you, between the two
Yeah.
of you? I mean, they're
Yeah.
more open, I
Absolutely.
guess, to the other
Hmm.
types of things
Hmm.
versus,
Yeah.
uh,
A DO, or a doctor of osteopathic medicine, it has really kind of always been the bridge between the traditional medicine and the alternative world. Osteopathic doctors usually learn manipulation of the body like chiropractors do as well. And many of them continue to do that service once they're trained as a DO. There are some doctors of osteopathy that have gone on to do residencies. And then once they've done a residency, they've kind of lost their more holistic approaches to things and taken more of the traditional Western medicine philosophy. But then you have some that really ride the middle ground between both worlds. And to me, that's the best of both worlds, right? That we're looking at both things. I'm not saying that traditional medicine is bad, because there's great things for that. If I break my arm, I want a doctor to set my arm so I don't have problems down the road. If I have a heart attack, I'm not coming to somebody like me. I'm going to the emergency room and I'm having them fix my heart. But
right,
if I have a chronic thing, yeah, they're not so great at chronic medicine. We're really good at symptom medicine, but we're not so great at finding the reason why somebody has a chronic issue going on. And so that's where a doctor of osteopathic medicine, a naturopathic doctor, an integrative doctor is going to be better at those types of things. And not all of us in this arena aren't in the insurance world. There are some. There are a lot of doctors of osteopathy that are in the insurance world. And there's a lot of tests that we can do in leverage in the traditional medicine world that can be covered by your insurance. There are certainly some functional medicine tests that are not, but a good bulk of things when we're trying to figure out what's wrong with somebody can be covered by your traditional insurance.
okay. And so is just kind of going back into the PTSD side of things, is that, I don't really know where I was going with this question, but I don't know. I mean, you go to a primary care and they refer you to all these different specialists and stuff. And for treating PTSD, because it is impacted by so many different types of things.
Hmm.
What kind of doctor do you see for that? Is that going into the psychological world and counselors and this and that, or is it, is it drugs? Is it functional medicine, or
Hmm.
is it a
That is a great
combination of all of
question.
it? I mean, what is this magic combination of
Yeah.
getting treated for it? And I don't know that
Hmm.
anybody ever completely gets over it
Right.
and
I
or
don't think people
healed,
ever
but
do.
yeah, but
Hmm.
it comes back to that, that management again of
Yeah.
how do I get through every
It
day
is.
and not feel like I want to leave the world?
Yeah. It is definitely a combination approach for sure. I think you do need your psychologist and maybe even for some people, a psychiatrist, although they're really just good for controlling meds and nothing else. But the psychologist you need so that you can start to work on these are my triggers. This is what I've identified as my triggers. Help me find a path so that I can manage my triggers. And if I do get a trigger, how do I pull myself out of it and recognize it faster so that I can move on and it doesn't debilitate me for hours or days or weeks. I think you really need that therapist person to help you do that. I think in the functional medicine world, we have lots of tools that can help us too. Certainly measuring neurotransmitters, maybe looking at peptides. It is there something physical that's happened as a result of this? Did something get off balance? Is your chemistry off balance? Are there nutrients and amino acids and vitamins and things like that, antioxidants that are not in balance properly that are making this PTSD experience worse for you? Because if we could optimize the body to be highly functioning, then every stress hit that we have should be less impactful on the body and not last as long. And so really optimizing that instead of just trying to find a way to suppress the symptoms, I think is the best approach that somebody should be looking for.
Okay, great. It, so with all, I think it's more prevalent now with a lot of people coming out, like, there's the Dr. Gundersons and this and that, and they've got
Mm-hmm.
all these, their remedies to fix
Mm-hmm.
everything in the world.
Yeah.
And even within, the medical community, that there's so much noise. And
Mm-hmm.
how do you get through the noise to know what to believe? Because people, myself, for instance, it
Mm-hmm.
just, you get, you research, you want to be informed on certain things and this and
Yeah.
that, but then it all just becomes overwhelming and there's contradictory information.
Mm-hmm.
So you sit there stuck and do nothing
Yeah.
while symptoms and everything else can
Mm-hmm.
continue. And how do you deal with that?
I will
What's your
say this. I
advice?
think there is a lot of noise out there. And we have to understand where the noise is coming from. There are a bazillion TikTok experts and YouTube experts out there in the market these days. But the one discerning thing I would say to you when you're watching them is, what are they selling me? Are they selling me this supplement or are they selling me on what I may have? We used to joke about this all the time about Dr. Oz. Dr. Oz phenomenal. If you took every single supplement that he recommended over the years that he was on TV, you'd never have time to eat food and you would be taking everything. But why was he doing that? It wasn't to necessarily educate us. It was to sell a show, which then sold something. And so we spend a lot of time on social media marketing our supplements and our products to people because we want them to buy them, not necessarily because we think they're great for every person. We just want to make a whole bunch of sales. And I think that that's a problem. And I don't like this with pharmaceutical drugs either when we're marketing them on TV. I don't think that's any better. And it does become overwhelming, and not everybody should take everything. There are some supplements that certain people shouldn't take because of their genetic makeup. There's certain herbs that we shouldn't take because you have certain conditions. And this is where you really want to work with somebody, whether it's a health coach or an integrative doctor. You want to work with somebody who's going to look at you as an individual and tell you specifically for you, this is what makes the most sense. You can't take this med because you have this problem. You can't take this because you have this genetic issue. or yes, this is a product that will help you immensely and won't have any problems, because otherwise you are going to take too many things that are going to contradict each other. And at the end of the day, you're just going to get expensive urine.
Expensive urine. Oh my goodness. Oh, wait, I could sit talk to you for hours on this kind of stuff. But so what in closing here, what message do you want those living with PTSD to hear most clearly from this?
I would say you're not alone and you don't have to live like this. There are people that can help you, even though you feel like you may be totally alone. And it's scary to admit that you have these thoughts going on in your head. There are reasons for you to feel this way, but you don't have to feel this way for the rest of your life. There are people that can help you, and don't be afraid to reach out and ask for help from somebody, whether it's a community member, a family member, a stranger, somebody that's posting online that they're dealing with PTSD. Just take the first step and reach out to somebody and have that conversation to lead you down the path of your own healing.
Awesome. I love that. Well, thank you so much for being with us
You.
today for another episode. And real quick, where can people find out more information about you? And then you've got
Yeah.
your book coming out too.
Yes, my book is coming out. It's called Seen at Last. You can find it on Amazon or Barnes and Noble. It's also on our website at serenityhealthcarecenter.com. And then all of our social channels are Serenity Healthcare Center. So YouTube, Facebook, Instagram, TikTok, all of those wonderful things these days.
All right, awesome. Well, that's it. Thank you for joining us again on another episode of Glow for Hope, Spark Conversation on Mental Health. We'll see you next
Thank you
time.
for having me.
They changed this stuff. I can't find out where to stop the recording anymore.
Oh, no, right? It's always in these different spots. I hate it.
I don't know where it is.
Is it in under the more button at the bottom?
Uh-uh.
Mm,
I used to just be able to just stop it. Very strange.
weird.
Well,
I can see the record button up in the top right corner, but it doesn't allow you to click on it or anything. Yeah, that's weird.
because when you go to record, it just says record to this computer or the cloud. There's no
Yeah.
stop or anything. Very strange.
Mm.
Anyway, good thing we can edit.
Yes, exactly.
But well, thanks.
You're welcome.
We are. I'm trying to get enough episodes in the bank here that we can launch with a few, and then get on
Awesome.
and then start doing them once a week with somebody to keep things going, and a couple
That's
other
cool.
people. So we're trying to. I think right now, trying to do it in September, and maybe our official launch will be like the week of um, Suicide Prevention Awareness Week, more than
Oh, that's
likely.
great.
So
Yeah.
just
Hmm.
to tie it all in, but so I'll
Awesome.
let you know when it airs and
Okay.
share the link and all that stuff with you.
Absolutely. We'll share it everywhere.
I appreciate that.
Yeah.
Excited about
Good.
your book and to see you. I
Thank
oh, and
you.
I on a personal note, I need to send
Yeah.
you. I just had some more labs done.
Okay.
Had some updates and not of everything, and then I got
Hmm.
some newer hormone stuff done too. So
Okay.
I'll have to
Perfect.
send those over to you.
Yeah. Perfect. Then we can connect and talk about it and figure out where you're at. That's
Okay,
what's on that part. Sounds
sounds
good.
good. All right,
All
take
right.
care.
Thank you.
Thanks.
You too. Have a great day.
You too. Bye.
Okay. Bye.